would like to thank Dr. Burgos de la Obra and the Lipemédical team for sponsoring this episode.
هاي، أهلا بيكم في الحلقة السادسة والحلقة الأهم اللي هيبتدي بقى فيها كل حاجة. دخلنا في الجد. النهاردة هكلمكم عن العملية نفسها. اليوم اللي قبليه باولا قالت لي إن أنا لازم أبقى صايمة قبليها قبل العملية من 8 ل 12 ساعة كده، بس طبعا أنا قلت ال 12 ساعة يبقى أأمن عشان ما تعبش في أي حاجة، وصمت من الساعة 12 لأنه العملية تاني يوم كانت الساعة 1. وصلت بقى المستشفى تاني يوم خايفة قوي وبعدين دخلت بلغتهم ان انا وصلت. انتظرت انتظار قليل قوي لحد ما طلعوني الأوضة اللي انا هبيت فيها. اتفرجوا على الأوضة جميلة ازاي، يعني لا بجد تحفة، والحمام شيك قوي وكل حاجة كانت حلوة ونظيفة، وسايبين كده باوتش صغير، حركة لذيذة قوي منهم. الباوتش دي بيبقى فيها زي الأوتيلات كده، فيها معجون سنان وفرشة سنان ومشط صغير وشوية حاجات كده واللوشن والشامبو وكده. فبعد ما دخلت الأوضة وحطيت حاجتي كلها والشنطة والكلام ده كله، وصلوا ممرضات وادوني الفستان الشهير بتاع المستشفى وبونيه كده صغير وزي شراب كده برضو معمول من نفس الخامة عشان البسه، عشان تبقى كل حاجة متعقمة ونظيفة. وقالوا لي ان الدكتور بورجوس هيوصل على طول. وصل الدكتور وابتدى يعمل الشيء الشهير بتاعه اللي هو يعلم على رجليا عشان يبقى مخطط كل حاجة قبل ما يخش يعمل العملية، يبقى عارف كل حاجة قد ايه هنا هيشفط من قد ايه والعلامات كلها، لان احنا واحنا واقفين واحنا صاحيين عشان ده بنج كلي، فاحنا طبعا نايمين بتبقى العلامات بتاعت فين نهاية العضلة فين التفاصيل دي كلها بتبقى مش باينة. فعشان كده هما بيعملوا العلامات دي عشان واحنا واقفين يخليني ابقى واقفة على طراطيف صوابعي، يعرف فين اخر العضلة السمانة، التفاصيل دي كلها يبقى معلم عليها عشان لما يخش يعمل العملية يبقى كل حاجة واضحة قدامه. شرح لي كل حاجة وحكى لي التفاصيل كلها. قال لي ان انا عندي شوية فايبروسز او تليفات في الرجل الشمال، وقال لي ان هو العملية عادة بتاخد من 3 ل 4 ساعات حسب كل حالة. وانا صورت فيديو عشان تبقوا عارفين برضو هو بيحكي ايه وبيقول ايه، وشرح لي كل حاجة. اتفرجوا عليه ونرجع تاني بقى للتفاصيل بتاعة العملية.
Alright, so here we are with Sally. We're gonna explain how to diagnose lipedema and what are the difference with other situations such as obesity or lymphedema. So first we need to know if there's disproportion. So in this case her torso is very slim and there's a clear difference between the torso, which is very thin, and the fat volume of the legs. We see how the legs above the quadriceps have fallen into the knee, and the knee has lost, the knees both have lost its anatomical shape. Also, we know that the texture of lipedema is very different from overweight. The belly fat is very soft, is very regular, and this one is very dense, very fibrotic. And when you pass the hand in the fat, you may notice that it's like a package of rice, a package of beans. So this is one of the main features of this condition. Another thing we need to know about is that the affectation is usually symmetrical or more or less symmetrical, whereas for example in other entities such as lymphedema, usually there's an asymmetry, one leg is much more affected than the other one. In lipedema, both legs are more or less similar, usually one a bit more than the other one, but just a bit. Another feature is the respect of the feet. So the feet are normal, we can take a pinch here, and there's no liquid, there's no fat in the feet. The feet remain normal, and just above the ankles is where starts some affectation here. So that's a clear difference with lymphedema. In lymphedema, the main issue is a problem in the circulation, the lymphatic circulation. That means that the liquid is going to fall down to the feet, and the feet, one of the feet specifically, is going to be much swollen. And we're going to notice that we cannot pinch here because everything is with liquid. Here, the situation is the volume depends on fat. That means that this is not liquid, it's fat. So when we press and remove, we press and remove, if this was lymphedema, it will stay a small hole in here. But as in the lipedema situation, the problem is mainly fat, that's going to mean that we're not going to see that small hole in there. Another thing we need to examine is the sensitiveness, the pain. Usually there's two main areas that have more pain. The first one is this one. I'm sorry, it's as a surgeon you need to be cautious not to do a lot of harm, but these areas when you pinch hard in here are usually very sensitive, and the other one is this area here. So you need to grab from behind to the front and grab this fat here with strength. And if you compare this pinch here with a pinch of the belly here, the pinch on the belly is not painful. The pinch in here, sorry, it's quite different. Turn around 1 minute, turn to the side. We see how we've lost the normal anatomy of the Achilles tendon. Turn backwards, please. And how here we cannot see the muscle. The muscle is down there, but it's covered with a fat layer. So step on your toes. So when she steps on her toes, here's the fat layer we see. We don't see the calf muscle. Go down again, and we see how the ankle is wide when it should be quite thin and quite defined. So one of the purposes of the surgery, of course, is to get rid of the pain, the symptoms, to stop the progression, and the other one is to restore, to recover the anatomical shape. So that's one thing that is for sure is going to change. We're going to obtain a thin ankle. We're gonna maybe able to recover the anatomy, the not normal anatomy of the calves. Turn around a bit. Another feature is the tubular shape. We see how we've lost the normal shin bone shape. Here there's volume, and in a patient without lipedema, usually we can see the bone. So another thing we're gonna try to obtain is to recover the normal anatomy, the triangular normal anatomy of the front part of the lower legs. And what for sure is gonna change a lot in this case is the knee. We're gonna remove both sides of the fat pads, and we're gonna look for find again the anatomy of the patella, of the kneecap, I think it's in English. In terms of volume of thighs, there's also some volume here, but this will be addressed in a second surgery. So today the main goal is go from the ankles to a little bit above the knee. In the second surgery we'll go from above the knee to the waist. That's mainly the situation. The recovery of the lower legs, usually it's a little bit slower compared to the upper legs, and the recovery of the skin usually is much faster and better in the lower legs compared to the thighs, that they need more time. And specifically if there's a little bit of previous looseness, we may have a little bit of looseness afterwards. But we need to know that the situation keeps improving for a year and a half. So what it looks a little bit loose at first, the first 3, 4, 6 months, a year and a half is still recovering and gaining, getting back to normal. So this is mainly this is an early stage. We see that there's no big deformities, there's no lobules, so there's volume, but not that much volume compared to other patients. Something we need to know is that the grade and the symptoms, they don't run parallel. That means that early stages can be very painful, as this one, but advanced cases with a lot of volume may not have a lot of pain. So early stage doesn't mean no symptoms or a few symptoms, may mean a lot of symptoms and a lot of discomfort, pain, heaviness, etc. I think that's me. Turn to the side 1 minute. We're going to show something else. There's frequently a ball in here, we call the lipedema ball, and we're going to reduce it quite a lot. Turn around to the other side, the other one. you see that it's bilateral. So there's a fat ball here. We're going to reduce a lot to help improve the aesthetic situation as well. One thing we see here is the bruising. In patients with lipedema, they get very easy bruised. That's because the small vessels, small blood vessels, they get very fragile. So with just small hits or bumps, they appear bruises that take longer to disappear. So here we see one of those features, and that's for sure is going to change as well.
وحبيت أسأله شوية أسئلة كانت بتجيلي كتير قبل كده، فشاركتها معاكم بأن أنا أصور الفيديو ده معاه ويرد على الأسئلة بتاعتنا. اتفضلوا شوفوا.
Thank you, doctor, for answering our questions. I'm very excited about the surgery, obviously, and I'm very, very happy. And I know that I'm in good hands with you and with the whole Lipemédical team.
Thank you.
I have a few questions that I get a lot on my page.
All right.
A lot of women ask me, especially from the Middle East, specific questions to the Middle Easterns. So the first one is, people notice that it's predominantly existent more in the certain cultures, such as in the Middle East. Is this true, or is it more global?
I think it's very global, but there are cultures that might be a little bit more present, or specifically less present. I would say that in Asians there's less lipedema, and in African women there's less. But I cannot say what country has much more than others, because there's a lack of diagnosis worldwide. So we're still not sure about that, but we know that Asians and Afro-Americans, they have less incidence of this condition.
All right, the second question is, I get a lot of questions about the fact that some women feel that they know that it's a genetic disease and that they get it from the mother's side. But some have noticed that they probably get it from the women and their father's side of the family.
That's right.
Is this possible?
It's absolutely possible. In fact, it's much more frequent that they get it from the father's side than from the mother's side. The thing is that what they usually see is the mother. But if you check the family of the father and the grandmother, they usually a little bit more affected than the mother's side. Yes.
Oh, that's interesting. Okay. As you probably know, Middle Eastern food is mostly reliant on carbs and fried foods and sweets. Does that speed up the progression of lipedema?
All right. We know that lipedema depends on several factors. First one is the hormonal one. We already spoke about that. Second one would be genetics, and the third one is the nutrition. So we know that specifically gluten, dairy, lactose foods, processed foods, red meats, etc. They have influence in this condition. We still unclear how much, but what we see is that very frequently when the patients they quit gluten, or they reduce a lot gluten and processed foods and pro-inflammatory foods, they see a lot of improvement. So the idea is maybe, if sometimes it's difficult to get rid of the gluten at all, but try to reduce it as much as possible.
How important is it to wear compression, especially that it's hard to consistently wear it in the Middle East and the heat in the Middle East?
So we need to know that compression has two purposes. We can use it as a conservative approach, meaning that this lady is going to use it for life to reduce the pain. The thing with the Middle East patient is that they cannot think about living their whole life with this compression, because it's true that it's very thick, it's tailor-made, and it's very effective, but it's not very reasonable to live 40-45 degrees with that compression for life. That's using it as a conservative approach. The other thing is they use as a preparation for surgery and post-surgery to improve the results, and this is more or less compulsory. We need that compression. So even though it's a little bit difficult, we need to wear it at least 6 weeks before surgery and at least from 3 to 6 months after the last surgery, because we know that the preparative use of it is going to make the surgery easier and the recovery faster, and the second part of it, the post-operative use of it is going to improve the results. It's going to accelerate the healing. It's going to improve the recovery of the skin as well.
why is the wall method better than other methods?
All right. The wall technique means to water jet assisted liposuction, meaning to use sprayed saline solution, like pulverized saline solution, that helps the cells to get a little bit loose. Then you can aspirate these cells with very thin cannula. And the main issue here is that it's much more delicate with the structures. It's much more delicate with the skin, with the blood vessels, and specifically with the lymphatic vessels. And also it allows us to get a much better definition of the details. A part of the surgery is to remove volume, and in Lipemédical we believe that the second part is as important as the first part, which means to be very, very attentive to the details, to be sure that the legs are as identical as possible, and to try to make sure that we not just reduce the pain, we treat the pain. So we receive more and more patients that have had previous surgery by other doctors when not much volume was removed, or there's some unevenness, specifically around the knee or around the ankle. So it's super important that we use a very delicate technique to try to obtain best possible result in each of the patients. No matter if she has 60 years old, we need to look for the best possible result for that patient. If it's 20 years old, the same idea, to be very attentive to the detail and to try to obtain best possible results in each of the cases with the minimal risks.
Perfect. And lastly, what would you advise the Middle Eastern women who are intimidated by the idea of obviously traveling to Spain for surgery, and if they need someone to accompany them? And so
all right, yeah, sure. Well, first, my advice is to research, to research specifically what is the team experience and what are their results. We are increasingly seeing doctors that they've never done lipedema, and now directly they advertise themselves as specialists in lipedema. So it's important to know what is the background of that team, if they treat many different conditions and lipedema is one of them, because you cannot be super specialized in everything. So if you treat breast, abdominoplasty, eyelids, and sometimes lipedema, you cannot be super specialized in lipedema. So my advice for a patient is try to find a team which is fully devoted and mainly treats this condition, because some patients, they have complex cases, and specifically for a complex case it's better that the surgeon has a lot of experience. So try to find a team which is super specialized in lipedema. Of course, traveling, it's always an effort, not just economical, but familiar, professional, etc. But I think it's really worth it if you trust the team you have the surgery with. And for concerning Middle East patients, the culture and our culture are quite similar. I think they find Spain like a very nice place to be, and we as a team, like not only the surgeons but the nurse and the pre-care and the aftercare, we take all the efforts so the patient feels taken care of. She has the phone of our team before surgery, has the phone of our team after surgery, and the phone of their own doctor to if they need anything they can call us. If there's something comes up, she can always come to the hospital right away. And what is true is we need the patients to stay at least 10 days here in Madrid, so they get very specialized MLDs, manual massage after surgery, and also for having a checkup before they leave. So I encourage the patients to travel if they find that a team is the proper one for them, and that they feel confident and they've seen many results of a specific team.
Thank you. And one thing I really want to add, Doctor, that I'm very much impressed with the fact that you, out of so many other doctors, takes care of the aesthetic side of a woman's curves, and you don't just do the liposuction and suck as much as possible according to the patient's needs and just you do anything. No, you're very careful about the aesthetic side and keeping the proportions right, and you have an artistic sense that I'm very excited about.
So the thing with this is, first, we don't need to forget that this is a medical condition, meaning that it has a lot of impact in the quality of life, implying pain, heaviness, sensitiveness. When you have one child on, you're very sensitive, etc. And it's a progressive condition, so a big part of this surgery is to prevent this from from developing more or for growing more. That's one side. And on the other side, we know that there's a full or an important loss of the normal anatomy. So I would say that more than aesthetics, we care of anatomy. We're going to restore the normal anatomy of the knee, of the ankles, and the idea is to match both objectives, the main one, which is the medical one, with the secondary objective, which means to recover the normal anatomy, the aesthetical part of it. And it's not just me, it's also my team that we need to know that it's not one surgeon in Lipemédical. We're 7 surgeons that we do this surgery every day. So I encourage you to also know my team. And yes, we take a lot of care because we know that the psychological part of this is very important too, because this condition usually appears in a difficult age. When you are a teenager, it implies a lot of emotional impact. The patients usually have been hiding their legs. They have been a little bit having a lot of complex. So another part of the medical effect is to boost confidence, to switch the psychological side of it, and that also helps a lot to keep the results. So the patients usually have been trying to lose volume from the legs. They work out a lot, but they are usually very, very frustrated when they get to our consultation. So once we restore the normal anatomy, they feel lightness, they feel much more mobility, no pain. There's a big psychological change as well, and that's going to help to keep the results, and also it's going to have a very positive effect on the mood and on the way they live as well. So yes, both sides are important. Now what's going to happen now is that the marking has already been made, so I'm going to go to the operation room where my team is already preparing everything. She's going to be taken upstairs to the pre-surgical area. Everything's going to be rechecked again, the previous allergies, the consents, etc. We're going to go in the operation room where we're going to apply some antiseptic liquid in the legs, and then she's going to be taken to the surgical bed. And contrary to the movies, operation room is a very calm place, very where things happen very slowly and very progressively, and the patient needs to know that everything is going to be informed and there's no rush. The movies, everything's running, the surgeon is sweating. This is nothing like that. It's much more calm, and there's everything. There's a lot of information. There's tranquility. So that's the idea, that the experience it's calm, and just before surgery it's calm, and after surgery the recovery it's also very progressive. Then she's going to be taken to the recovery area. She'll stay there between 1 or 2 hours to see that everything's fine, she's not feeling dizzy or sick, etc. And then she's going to go back to the room, where she'll see, at first it's going to be a little bit sleepy, etc., but she's going to recover little by little. They're going to give you a little bit of water around 3 hours after you come back, and yeah, we're going to progress in the afternoon. We're going to sit you here, then you're going to be able to stand a bit, and the idea is that this night she can walk a little bit towards to the toilet, and if everything's fine, as it usually is, she's going to be able to leave tomorrow morning. All right, that's the idea.
Okay, great.
Okay, let's go for it.